Welcome to episode 12 of WooWoo for the Skeptic. I'm Kim Polander, your host and curiosity advocate for the world of metaphysics. Today I'll be talking to Michelle Giliberto, who is a medical intuitive. Michelle counteracts illness and disease using an energy modality of vibrational therapy. Can you really improve someone's health by energetically sending them specific vibrations? And how do beliefs in the subconscious mind play into this? Well, let's go straight to the interview to find out. I'm excited to be talking to my guest today, Michelle Giliberto. Michelle graduated with a Bachelors in Communications from Boston University, and her initial career was in marketing operations for various financial institutions. But due to the health challenges of her children, she became very involved with the medical world. She now practices as a medical intuitive and has created her own unique way of healing based on vibrational therapy, Thetahealing, and Reiki. She is also a co-founder and board member of the nonprofit organization Epidemic Answers, which connects parents and caregivers to recovery solutions for children with chronic illness. Michelle, thank you for being on the show and welcome.
Hi, Kim. Thank you for having me. I'm very excited for this opportunity to chat with you today.
All right. Well, tell me how you were swayed from marketing to energy medicine.
Well, I really was enjoying my career, and then my husband and I decided that we were going to start a family. And I had my daughter 11 years ago, my son 9 years ago, and we had pretty significant challenges with both of them pretty much right off the bat. And my daughter, she was suffering with a relapsing fever syndrome from about 6 months old. That's when that started. And she had chronic ear infections, really severe allergies. She was having a lot of problems. So I decided then that I would take some time off from work and stay home and try to sort that out and see what we could do for that. And then my son was born as well. And he had really terrible gastrointestinal problems, sleep problems, and then was diagnosed with autism spectrum disorder by the time he was 18 months old. So that really changed the trajectory of my life big time, because I was really looking for answers, how to help them feel better in their bodies and get well. And I had to put that career aside, but it was really a blessing, because that's what got me on this path to healing, was watching my children heal and kind of learning some different modalities and techniques to help them really just turned into what I'm doing today.
So at what point did you start looking into alternative methods, such as like even energy healing and that sort of thing?
That actually took me quite a while. We did pursue some traditional routes with them first. We were going to a lot of different doctors to try to uncover what was going on with our kids. And so we did a lot of genetic testing and going to infectious disease doctors and things like that. So I was really just trying to get a lot of information together and trying things that way, but we weren't getting very far. And I knew that we needed to look at something else. And I was rather skeptical of energy work. I wasn't really looking for that. It kind of just fell into our path. So my first introduction to it was kind of funny, because I really didn't know much about it. And my doctor, my MD for my son, said, you really need to call this woman and she's going to help you. And I felt like I had PTSD because it was triage all the time in our house with the kids being so sick. And I thought she had me calling a therapist. I thought we were going to have a chat on the phone. That was what I thought I had scheduled with her. But when I got on the phone with her, she told me to go lay down and to get a glass of water, which I thought was strange, but we had this really wonderful, wonderful doctor, and I trusted her. So when she told me to call this woman and she was going to help me, I listened. And so I went ahead and laid down on the bed with my water. And she said, okay, we're not going to talk for a little while. I'm just going to check things out. And it was really interesting, because I could feel, it was like I felt this energy and this warmth coming through me. And it made me nervous, because I really didn't know what was happening. But that was my first experience with energy work that I was really aware of. And so then the woman proceeded to walk me through what we were actually doing. And she was a shaman and an energy healer. And I felt so good at the end of that hour. We did do some talking in there, but I couldn't believe how good I felt and how peaceful I felt after. This was maybe 2 or 3 years into this process of stuff going on with my kids. So it was a huge change for me to feel that much peace and to feel that good in my body after what we'd been through. So I knew that there was something to it, but the way that I was introduced to it, I thought that was interesting because I don't know that I would have chosen that if I had known what I was walking into that day.
Yeah. And it's so interesting to me that it came through your MD. So that's really encouraging that your MD was so open-minded to it and knew that you would be receptive to it. And yeah.
Oh, she's a wonderful, wonderful doctor. She's helping many, many children. And she is an MD, and she does use some traditional methods, some alternative methods, and, even recommending healers. So it's a beautiful thing. And I feel really grateful that she came into our path when she did.
Yeah, definitely. So now what you do is work with vibrations. And so what is the modality that you settled on that you found to be most effective in your experience?
Well, I actually use a combination of modalities currently in my practice. So I would say the ones that have had the most impact on me, the first one was Reiki, because that taught me more about distant healing and that you can work distantly and that you can work with energy, whether you're sitting in the room with someone or not. So that was really important for me to understand, even though I had experienced it that time with that one session. For me to understand that we all have the ability to do that. I learned that through that modality. Even though I don't technically offer Reiki sessions anymore, I still work with that perspective. Then I also trained as a medical intuitive, where you actually look for the root cause of an illness by matching the vibrational signature. So everything has a frequency. So if you have a sore throat or a cold, what I will look for is what's at the root of that. Is it a virus? Is it a bacteria? And if so, which one is it? What is the frequency of that? It's really like dialing into a radio station and just getting that right match so you can hear your program or your song. It's the same thing with illness. We're just looking for the frequency. That is a huge part of what I do, is matching frequencies so that they can transmute. I also use theta healing quite a bit. So I'm a certified theta healer, and I like to really combine finding the frequencies of what's been manifesting in the physical body and pair that with the beliefs, the programs, the obligations that are running in the subconscious that magnetize those physical conditions into our body. And the combination of that together is a really great foundation for healing for most people, I think.
Yeah, that's a wonderful combination. And in my experience, most practitioners use a combination of skill sets as well. So to break it down a little bit for the listener who might be new to energy healing, I think most people have heard of Reiki. So it's nice to hear that you validate the whole concept of remote healing with Reiki. It's my perception and my experience that most any modality will work remotely. So can you speak a little bit more maybe to your experience with discovering that?
Yeah, when I was studying Reiki, part of the teaching was that you had to perform these distant sessions for people as part of the training. And you're going into that really not knowing what's happening on the other side, right? But then we would get the feedback from whoever we worked on. So that started to validate that back to me that was possible. I have found in my experience with my clients that we can offer that frequency that heals, or transmutes the vibrations that they're holding in their body very well. It doesn't seem to matter whether it's in person or not. I've worked with hundreds of people this way. And whether they're with me or not with me, we tend to get the same results.
And then when it comes to, so now the vibrational work that you do, you mentioned a radio station. So every illness or disease has a frequency that comes up on the radio station. How do you find out what the frequency is?
Well, I like to work with people where we use muscle testing, applied kinesiology. It's not totally necessary, but I really like using that tool because I often, on my end, if I'm looking for the frequencies, I hear them a lot or I see them, and I'll measure how much of that frequency is the cause of the symptom. I often use my pendulum to measure that. I use kind of like a protractor board and a pendulum to measure so that I'm looking at it like, where are all the pieces of the pie?
Okay. And I posted a video on just basic muscle testing and explained the sway test. Can you just briefly explain the concept behind muscle testing?
Sure, I can. So a muscle testing is using your energy in your body to see if something is true for you or not true for you. Because, in our mind, we might just think like logically that something is true for us or not, but we want to access the subconscious, the wealth of information that's really in the body. And so we'll use muscle testing, for example, in the sway method, where you're just kind of like standing in a relaxed fashion, and you can say a question or a statement. And if it's true for you, your body will either stay really strong or move slightly forward. If a statement or a question is not true for you, you will move backwards. Let's say that we're looking for, the root cause of fibromyalgia, whether it's something like a pathogen irritating the nerves, or if it's something in the muscles. We can start to tease out the root cause of that by using statements and seeing how the body moves forward or backwards, and get some really deep information that way. There's different ways besides the sway method to apply that testing. That's a really good one, though. I really like the sway method, actually.
Yeah, I do too. I found that it tends to be the most neutral versus the finger test and all that.
Sure. Yeah. And I like it because I do work remotely with a lot of my clients. And that way they can be testing on their end, even if they're not in my office. In my office, sometimes I'll facilitate the muscle testing for someone by using the O-ring and, breaking their fingers apart myself. But I like it so much because despite whatever I see or feel or hear for a person, I like for the person I'm working with to really feel empowered to getting their own information. And I feel like energy testing really helps a person do that because it's giving you a visceral experience. You get to really feel and see if something is true for you rather than just listening to what I'm saying as the facilitator. And there is a deep feeling inside of us that when we get that yes or that no, the more you use it, the feeling you feel when something is true for you, and then you get that tangible move forward or move backwards, really kind of reinforces what you know inside. And so it's a really nice way to get even more in touch with yourself.
Yeah, and I love muscle testing because, like you said, it does tap into the subconscious, where in my conscious mind, logically, I'll think, oh, no, I don't believe that. And I'll do muscle testing and it'll be the exact opposite answers. So it's very revealing. And you can use muscle testing, for things like food, which I've mentioned in previous episodes, but it's a nice internal barometer.
Yeah, it is. It's great. I have taught a lot of parents to use it so that they can test foods for their kids or supplements and really see what's going on, because we're often given so much information. It's like, how do you digest all this information from all these different sources about what's highest and best to use for your kids?
Yeah, and what might be good for someone else's kids or for someone else's body may not be good for you, even though it's, there's nothing wrong with an apple or kale or something. It all depends on what your body is suited for.
Absolutely. Absolutely.
Okay, so you've now described how you find what the frequency is behind the illness. And it's also interesting to hear that it may not be the same thing for every person, say fibromyalgia. So it's really important to zero in on what is lying underneath. What do you do with that information then?
Yeah, and I feel that we are all so unique. Our makeup is unique from person to person. So it really is important to find what it is for that individual. It's like each time approaching it like it's new. So let's take an example of something simple like a sore throat. And let's say that person is testing for strep. And there are actually many vibrations of strep because there's so many forms of it on the planet. So you find the one that you need. And when you offer that frequency up to someone, it's matching, and it's like a sine wave. It collapses, it transmutes. So it just changes form. So we're not looking to pull all bacteria, let's say, out of a person, because we really do need some bacteria, some viruses and such in our body. It's part of our makeup. But when something is out of balance that way, you want to transmute that overabundance of it so that the person can come into balance. So I have a process of integrating that vibration energetically for a person, but it's really an offering. So I go through a process of energetically preparing that person and their higher self, like giving them a user's manual of here's what's coming and this is how you can use it. But the person is really doing the healing themselves. So I'm offering that vibration to them. It's like showing them that they can use this tool to heal and the way that they can use it. And then they're choosing to take that in the best way for them.
Okay. And you mentioned the higher self. How would you describe the higher self?
The higher self, to me, it's like that overarching part of us that we're here having this logical human experience, but we also have a soul. And that soul is guiding us through our learning. And it really knows what to do for what we came to learn. But sometimes I think we can pick up some extra tools and other possibilities of how to do things. But that's how I see the higher self.
So when you offer up the vibration, so you're using energy, you're using an energy modality at this point to offer up the vibration to them. And let's say they accept it, both consciously and their higher self accepts it, then the new vibration gets put into them?
It's offered up. So it's like an offering, and I'm not putting something into someone. So the way that I see it, this is my perspective, is that we are all our own best healer. So there isn't even a way for me to force a healing on someone or push something on someone. It's more like a conversation between me and that higher self of the other person, and in offering that up to them so that they can then use that themselves.
Okay, so it's available for them to just choose to integrate when they want to. And if they do choose to, access to that vibration will then counteract the illness vibration?
Yeah, because it's the counter vibration. So for example, with strep, it has a certain vibration. You're offering up the counter vibration of that so it can transmute. And, there are times when I feel a resistance to that. And that's where we do the belief work. Look at why that thing is serving a person. So for example, if somebody does have strep throat, they're probably feeling some pain in their throat. They're sore. They're a little bit down. And there's a few reasons why we might attract that in. We may need a little downtime, a little rest. We may need to take a step back. There could be something expressing through the throat where someone doesn't want to have a difficult conversation, or they don't feel comfortable speaking their truth. Or maybe they feel like they talk way too much and they want to learn to listen a little better. So they give themselves something that allows them to be a little more quiet and have a different experience. So we might look at what it is for that individual, why they're expressing that physical condition and how it's benefiting them. And sometimes when we get to that part, how it's benefiting them, and we bring more awareness to that, it is easier for them to let go of the physical symptom.
That's fascinating, because as a kid, I had strep throat pretty much 3 times a year. And looking back, it was definitely related to throat, expression of self, being able to verbalize things, and which I couldn't. So is it accurate to say that beliefs attract vibrations, hold them in place?
That has been my experience. That is my perspective, is that it's almost like it works together, right? So in your example where you had strep as a child and you're having awareness on what that might have been for you, the things that you're working with, the limiting beliefs, those beliefs are there. It's something you're working with, but it's really for your learning, right? It was for your learning. And so it was valuable for you to have that experience. And the strep will anchor that in place for you so you can have that experience. I see them kind of working together. But once you have an awareness of that, it's like, do you have to continue doing it that way? Or can you expand out the ways that you're learning that without needing that physical symptom? What are the other possibilities available? That's what I like to bring in for people, is what else is possible? Like, how can you know how to have that expression, how to speak your truth, how to be in your authentic self without needing the strep to learn it.
And I would think that without pulling the deeper beliefs tied to it, that the illness could more easily return. Let's say someone has strep throat, you offer the vibration to counteract it, but you don't pull any beliefs. Do you think that person is then more susceptible to attracting strep again next year if they don't pull the beliefs?
Well, everybody's different. So sometimes if you just release that pathogen, the consciousness of that bacteria is also being released. And that may be in that instance all that they need to get that deeper lesson. You know, that removing that block and releasing that block might be what they need for their evolution in that. And that might be okay. But I do sometimes see that. You're right, that you release that physical pathogen and nothing shifts with the beliefs yet. And if it doesn't, it's not speaking to a flaw in that person. It just means that there's more for them to learn. And you're right. They may need some belief work. There may be something else that they need to experience in order to have that deeper awareness and understanding and shift.
Yeah, well, that's great that you do the belief work automatically, because I would think that would be such an important component just in case there are any beliefs that are also attracting that vibration or tying that vibration in place.
Yeah, I do like to offer it. I do feel that's the best combination. It has to resonate with the person, with the individual. You know, they have to feel comfortable doing that work. Even if they are not necessarily interested in changing the beliefs, I still offer what I see because I feel like we're all working with that in different ways. And I like to honor that in people. I really feel like when you have a lot of chronic illness going on, if you're open to it, it's a nice way to do it, is doing the belief work automatically with the physical transmutation of symptoms.
Yeah, and I can see how chronic illness is definitely an indicator of a belief system where it just keeps pulling it back into the body, potentially.
And sometimes we'll have a symptom come back and it's not the same cause. Just really interesting because, you know, like you were saying with strep, I do see that sometimes people will heal a physical symptom and it will heal the root cause. And at some point, some juncture later, when they're coming around to some other level of that lesson for themselves, they'll manifest the same symptom with a different root cause. And it's really interesting. It just tells me how brilliant we are. It's like the body knows that we pay attention to that symptom. So it's like, let's create that again so we can get some awareness on this. And it's really beautiful how we can do that. And I think it allows us to go deeper into the belief system there when we manifest something similar again.
Yeah, so it really is the body supporting us in giving us communication, giving us awareness.
Yes, I actually do see it that way. I think that, you know, when I work with people, before we even look at the illness, I like to look in and see all that's going really well and right, because we are such amazing creatures in this physical body. There's so much that is really working well. And it's nice to acknowledge that, like, the body responds to that validation of all that's working well and almost relaxes a little bit more when we start to look at where we could lift some of the blocks and make some change.
Yeah. All right. So when you say you release the belief, what is that process? How does that look?
To release the belief, I do use theta healing quite a bit. And we're working from a theta brainwave, which is allowing us to more easily access the subconscious. It does not involve hypnosis, as you know, but sometimes people do ask me that. But we're accessing a theta brainwave where we more easily can make those changes. So that's what I do first, is just bringing someone up into that theta state so that we can do the energy work to make a belief change. So it's a gentle pulling and releasing of a limiting belief and offering the download of the more positive belief in place of that.
And is that belief permanently pulled?
Usually it is, but I do see that there's levels of beliefs where you could have some beliefs that will shift. And if it doesn't hold, to me, that means there's a core belief, something deeper that we need to really look at. It's not so much that it's not working. It's really speaking to the integrity of that soul wanting to get down to the core belief. And when we do address the core belief that those other beliefs are tied to, those limiting beliefs, I do see that being a more permanent change.
Yeah, and that's been my experience with theta healing, in that when you have a belief that comes back, like I am unworthy of money or love or whatever it is, you pull it, it goes away, and then you test yourself again and it's there. There's usually a root belief. So it's kind of like a house of cards, where if you can get to that super root, as my friends and I call it, or the bottom belief, the house of cards will fall and all those other beliefs fall as well. So it's really powerful in that way.
It is really powerful. And I feel like, once you make those changes, you're vibrating differently now, right? You have made a shift. And so from that different vibration, you're going to start attracting other experiences and people that really facilitate that change for you. And the experience is really important too. I think it's really powerful to acknowledge the experience that you have after you make a belief change, what shows up in your life. And sometimes you'll see things shift really differently in your life. And other times it's more of an awareness of how you are seeing things in your life or responding to things. Like you'll be more aware, like you were saying, like if you're not worthy of money, it's kind of like a gradual process sometimes where you'll make the belief change that you are, deserving or worthy of that money. It's not like millions of dollars are just pouring into your bank account the very next day, but you might actually start noticing your language around money, where you might have, a story or language around it where you're saying, like, I can't make money, or I can never make money, or something like that. And even just in that awareness, a change is made, and even more shift is possible from that awareness. So you might start with that awareness and then start to see more of the beliefs attached to it, so it's a really nice process.
Yeah. So let's talk a little bit about real world applications and how this work has shown up for you and the types of clients that you've treated. Are there any certain patterns or any types of illnesses or diseases that you mostly work with?
I do work with a really wide range of illness because of the situation my children were in. That was really near and dear to my heart, was really discovering root causes of chronic illness in children, because there is such an epidemic of that right now. So I did spend quite some time, and I still do research this and look for what else we can learn in terms of healing children from, ADHD, autism, Asperger's, PANDAS, allergies, asthma, obesity, all these things that are really cropping up in such a big way. And I actually teach protocols for that as well. So that's been a big focus for me for quite some time. And I do tend to have a lot of clients looking for that type of support in healing children. And in doing so, though, it really is about healing the whole family. I have branched out from, working with healing the children of those illnesses and looking at the dynamics of the whole family and why something like that was created for all of them. And so I do tend to do a lot of work with people on relationships, how they're relating to either their partner or their children, things like that. So I do that as well. I have worked a lot with Lyme disease, a lot with depression, things like that too. I also work with people on other things like weight issues. So I tend to have quite a variety of clients. And as a medical intuitive, I'm kind of open to meeting the person wherever they're at, so they might come with, my child is really sick. And then we end up looking at what's been going on in their life and like what their health is like too. So
I was thinking, if we do a little deeper dive into something like, say, autism, how did that diagnosis process look like? Can you tell a little bit about the beliefs that were associated for you or for your child and kind of the general approach that you have with autism? Okay.
So in my personal experience with my son, he had the manifestation of autism. So what he looked like was, from, I would say, about 2 months old, he had such bad gastrointestinal problems. He would fluctuate between constipation and diarrhea and abdominal pain. So he had trouble eating always and had trouble eliminating, and he was in a lot of physical pain over it. and he didn't sleep very much. So he could sleep for about 45 minutes at a stretch. That was his max. So that was as, a newborn. And then by the time he was 12 months old, he had not hit any of his milestones. So he wasn't speaking. He didn't make any eye contact. He does what they call stimming, a lot of repetitive hand flapping, spinning wheels, and things like that. He couldn't really play with toys, and he couldn't really be around people, and he couldn't be touched like by really anyone but me. I mean, I couldn't change his diaper and things like that, but he didn't really want any other people touching him. He couldn't really tolerate a lot of people being around him. So, and he had a lot of ear infections, rashes, all kinds of things like that. So that was my experience with him when it was really at its worst. And the beliefs I was working with as a mom was, am I a good mom? How do you love someone who doesn't appear to be able to give you love back? Like, I was really learning about unconditional love because I loved this child so much and he didn't respond to it. It's like you're constantly offering this love and support and care for someone and not really getting any positive feedback from that. So it was an interesting set of beliefs I had to work with there. What kind of mom I am and how much compassion, love, and understanding can I have, and like, how far will I go for this child? So those were some of the programs I was working with. Also, when you have two sick kids like that, at least in my experience, and what I did have to look at eventually was, what am I really distracting myself from? Like, what's going on even deeper down that I'm creating my life that is in constant chaos? What am I not wanting to pay attention to? And I really didn't get to that until my children started to heal and things calmed down, because when everything settled, my own stuff in my relationship with my husband and myself really started to come to the surface. And I realized having all that chaos was keeping me from having to look at that. So,
yeah,
so that was really an interesting process and a little bit scary. It was scary at the time, but being on the other side of it now, I'm really, really grateful for that contrast that showed me that, because it allows me to have a lot of compassion and understanding for other families going through that and gently walk them through that process as well. So that was my experience with my son. And in terms of healing him, I mean, we did so many different things in standard medicine and alternative medicine to help him heal. But I saw the biggest transition for him when we started doing this vibrational therapy and clearing those root causes fundamentally in him out. That's when I started to see him make eye contact and be more comfortable in his body and be present with us. And now he's 9, and you would have no idea that he had this past. He's really pretty much a mainstream child in terms of, like, he gets good grades in school. He's very social. He's in a regular public school. I mean, he used to have an aide that had to go to school with him, and now he's just fine on his own. He's very social, but also very lovable. He knows how to communicate love to people very easily. He's like probably the most affectionate person in our family now.
Wow, that's amazing.
It really is. It's been a huge gift that I'm grateful for.
Yeah. And so another example that comes to mind is something like anxiety, which to me is, I've had so many clients with it, and it just seems to be popping up more and more, where there are so many different triggers. And I'm curious what your experience is working with clients with anxiety.
Yeah, there are so many triggers. And in terms of beliefs, there is such a wide range of beliefs to look at when anxiety is present. I do find, though, where I like to start with a person in terms of beliefs with anxiety is about distraction and uncomfortability being in the present, because anxiety is a lot of worry. But from a physical standpoint, there often are a lot of physical factors that are bringing in a needless amount of anxiety. And I like to lift that off. Like, it's like lifting off debris so we can see more clearly what the beliefs are, what's attracting in the anxiety. And I will look at hormonal imbalances, blood sugar imbalances. Often the combination of those two will produce a lot of anxiety. But there's a lot that you can clear off in that way, balancing the whole endocrine gland system. But I often, with women especially, the pituitary and the adrenals, if those hormone functions are off and their blood sugar is off, it will produce anxiety.
Yeah, and I've seen a lot of gut issues, so beliefs related to the intestinal, digestive system.
Yes, absolutely.
Yeah. And then another example you mentioned was depression. So what sort of beliefs have you discovered associated with that?
It's really interesting with depression. It's another one where there's a lot of different beliefs, but one of the more common things I find with depression is fear underneath that. There's this like fear of really stepping into our authentic selves. You know, like I hate to use the word power, but feeling like we are, you know, that light in the world and what to do with that. There's some kind of fear energy about that with a lot of people. And it's a distortion. It really is, you know, that I think can keep a person down and keep them in that low energy, that low, tired feeling of depression. But I often, from a physical standpoint, see someone feeling like they either aren't safe or allowed to really step into that place of being the light in the world that they are, and bringing in some forms of fungus into the brain, believe it or not, that really facilitate that feeling. But it is also a gut issue. It is often dysfunction going on in the digestive system. There's a brain gut piece that needs to be looked at, but it really is about dialing into the specifics for the individual there.
And I actually had an appointment, a couple of sessions with a medical intuitive, your counterpart here in San Diego, Carrie Connell. And one of the things that came up in my session was liver exhaustion disease. Can you explain a little bit more about what that is?
Yes. So liver exhaustion disease, what I see with that is through being on this planet, there's, you know, a variety of factors that come in through the water we drink, the air we breathe, the food we eat, all of this congesting the liver. You know, in this modern day world, there's a lot of stuff that our bodies don't know what to do with. And a lot of it gets stuck in the liver. The liver exhaustion disease, you have that going on in the liver. It often really taxes the adrenal glands. So that's the exhaustion factor. That can make you feel so tired because your body's detox system is really compromised and your endocrine gland system is going down, especially in the adrenals with it. And it can just set off a whole other series of events in the body. And it often expresses as exhaustion. It can express as depression. A lot of people report things like low libido or anxiety, but also other physical conditions getting triggered from that. And like Carrie has probably mentioned to you, when we see liver exhaustion disease present, everything else is really slow to heal. Pretty much everything else. So we always look for that first to see if that's there. In children, I see it too. I see that if one person in the house has it, probably everyone else has it. Sometimes the children carry more of like a residue of it than the actual condition. So I look for the difference there. But yeah, when it's present, it just makes everything else really slow to heal. So lifting that off is really like bringing in a boost of energy to someone. It's allowing that whole detox system to work better, which is so important now because we do have all these toxins and man-made things in the world, but you know, we're here and it's supposed to feel pretty good, I think. And we're not supposed to feel afraid of everything in the environment. You know, how can we keep pace with what we're creating here in this experiment on the planet? So I like working with the liver exhaustion disease so we can more comfortably live here and feel sort of healthy here too. You know, I think that health is our divine right and we have the tools available to us to create that. And healing the liver exhaustion disease is a really great way to start.
Yeah, and it was startling to me to hear her say how many people were affected by it. So that's the only reason I mention it is because it is something that's so prevalent.
It is really prevalent. And she and I both have that as our standard check. We have kind of like all these standard checks that when we work with someone integrating vibrational signatures, that's number one on the list always. I would say that I see it about 85 to 90% of the time.
Wow.
Yeah, it's that prevalent.
So I'd like to shift a little bit into this idea that, or actually something that I've noticed in the spirituality world around illness and disease, and that is blaming the person. Not so much blaming, but maybe some subconscious judgment there about, oh, I have pain in my shoulder. Oh, well, you're carrying the weight of the world. Why aren't you fixing that? Or, oh, I have a pain in my eye. And then the judgment is, oh, what are you refusing to see? So I really want to make sure that we get the message out and talking about this stuff that, just talking about the beliefs associated with illnesses, that there is no blame here towards the person and no sense of guilt that we're trying to lay on you. Like, look, you have these beliefs, get rid of them. It's your fault. So what would you like to say to people who might be thinking that, especially with their children?
Yeah, because I feel like really at the end of the day, we're here to really learn. We're just here to learn, and we'll give ourselves things to learn from. And I really do like to work with the belief systems with individuals about that, like an if-then type of belief. Like, if I fix this, then I'm okay. We're all perfect as we are. That's why when I first look at someone, I like to look at all the things that feel like they're going right and are working for a person, because we're bringing in these things for our own evolution, and there should be no judgment on it, whether it's your own personal thing, right? You have an eye problem and you're not seeing, or if it is your child, because we are all here in our divine, perfect being, and we're bringing in these things to work with. So yeah, you might change a belief and have a shift there. But if a person doesn't do it, they're doing that for a reason. I honor that. I honor a person's process and their divine timing. Things will shift and change as is perfect for them. So I'm open to all the possibilities when working with someone of how they're going to do their own process. And they may not need to change all these beliefs at once. They're going to change it as they need to change it. And yeah, it's an interesting thing to work with families where kids are having all these problems. And as a parent who's been through it, I know that when I started with my son, my mentality was like, how do we fix this mess? Like, I just want it fixed. I don't know what to do with this. There was a lot of fear in that. And as I worked with that, I learned the more I let go of the outcome, the better things got. That was really the big shift for me, was I'm letting go of that outcome. I'm letting go and I'm seeing him perfectly. Like, he's here to teach me. I'm here to teach him. Like, we're in this process together. Like, what are we going to learn? And it wasn't so much about, fixing a specific symptom anymore.
Yeah. It became a bigger picture then.
Yeah. And it's interesting to work with the belief system there of when we do have a judgment, we don't necessarily have to come at it that way. There's a lot we can do to honor each other in our process wherever we are. I've had to learn that the hard way. But I have to say that I do see more opportunity for transformation when we do let go of those judgments and that blaming type of energy, even on ourselves. I think we're really hard on ourselves about, like, I've got to change this belief so I can feel better. There's so much opportunity for transformation just in the awareness. Just being aware, like, well, maybe I do have beliefs about not being able to see things. And so that's why, my eyes are having a problem. Just even acknowledging that will facilitate healing and transformation just right there.
Yeah. And that's an important point about just the awareness, creating a vibrational shift or emotional shift in someone at any subtle level, where a lot of times, especially clients who have had chronic problems with their body, it kind of creates this really negative relationship and this resentment towards the body, when really the body, through illness or diseases or whatnot, is just communicating with you, and it really has your best interests at heart. And even things like, in my own personal journey, we'll call it, negative things such as not being able to speak my truth, looking at that as a positive thing in how it was serving me, how it was protecting me, and coming to resolution with that, and then being able to shift. It's really important to come to resolution with how it was such a gift and how it was serving you before you can transform, so to speak.
Yeah, I agree. In a lot of my sessions, I spend a lot of time doing that energy work around that, like talking with the client about how perfectly they set it up for themselves. You know, it was like a perfect construct that they're making so that they can learn, like not being able to speak your truth and having that pain in your throat is like a perfect construct to bring your awareness to that, right? And so what I work with is, you know, clearing the trauma, but also when we bring in forgiveness and gratitude for what we've learned and acknowledging what we've gotten from that construct. And I invite people to bring more love to that part of themselves. Like, you know, your throat, for example, having that pain, like, wow, you know, that your throat's like, I'm going to take one for the team. Like, I'm going to experience this pain to bring a greater understanding and awareness and expansion for the soul. Like, how beautiful is that? You know, instead of being mad at that part, like, why are you sick again? It's like, can you bring more love and gratitude to that part of you that's working on your behalf?
Yeah, for sure. What is your experience with skeptics, or what would you say to skeptics who say vibrational energy? What are you talking about? Frequencies, all of this.
Well, I was one of those myself. So,
well, what was the most convincing thing for you then to come to the other side?
For me, it was that experience that I had with that healer, which I know I wouldn't have gone into. If somebody had said to me, I'm sending you to a healer and she's going to do remote energy work on you, I probably would not have picked up the phone and called her. So I was one of those people who was really skeptical. You know, I think that that's perfectly normal and great to come to anything with a little bit of healthy skepticism, because there's so much out there, especially with, you know, parents who have kids with chronic illness. You get bombarded with modalities and options, whether they're standard or alternative, right? And how do you decipher between all of that? So a little healthy skepticism, I think, really can facilitate making an informed decision. It's an energy that motivates us to do our research, to, you know, test things out and see what resonates with us. We're looking for, you know, what feels true, what rings true for us. And so the energy of that, I think, kind of helps us have that discernment and that information. So I think that's a great thing to have. You could be that informed decision maker.
Yeah, that's a good point about skepticism being a motivator to research things and find out what's true for yourself.
I think that was true in my process because I was very skeptical. I was skeptical, but saying to the universe, like, how am I going to help my children? You know, can you please show me the way? Like, you know, I need something. And so I was presented with a lot of different options and then had to make some decisions about that. So I didn't just go in and throw everything at my kids. But I think having a little bit of healthy skepticism helped me decipher between the options that were available.
Yeah, definitely. Well, Michelle, thank you very much for speaking with me today. And it was really insightful, especially your journey with your children and how you got tricked into the energy world. I love that. And before I let you go, I wanted to shift gears once more and ask you some fun questions, if that's okay.
Oh, sure. Yeah.
Get to know a little more personal side of you. So what was your crowning achievement in grade school?
Oh, well, let's see. Probably that I won the science award.
Wow. That's impressive.
When I was in elementary school. I say that now because back then I was actually really psyched about it because I did love science. And I was really proud of that moment as an adult, you know, transitioning from one career to another and getting into energy work. You know, there's a lot of questions and a lot of doubt that first comes up. It's that skepticism, right? That you really need to work through to find what's true for yourself. And I remember getting into, because I work a lot with science, as a medical intuitive, I have to understand the science of the body to be more effective in that work. And that was a really nice reminder, as I was going through that process of doubt and can I really do this? It's like, you know what? You've always had an affinity for this stuff.
Yeah, that started very young. What was the science project about?
It was that year for the class. It was like at the end of the year, there's like who had the best achievement in science, math. I won the science award that year. So, but it was like, it's something that's really stuck with me, even though I studied communications in college. That was my degree. But I always loved science. It was just always really fascinating to me. And I've always really just taken to it. And I use it so much now, that it was, that was definitely it for me.
Wow, very cool. Congratulations.
Thanks.
Okay. And secondly, what was the worst thing you got in trouble for with your parents?
Oh, that's a really good question. Yeah, I wasn't really a troublemaker as a kid, or either that or maybe I didn't get caught very much. Well, I always had intuition. I just didn't understand that I was using it when I was a kid. Like, I just really didn't understand. I thought everybody heard things and saw things like I did. I didn't know it wasn't like that. So if anything, with my parents, it's like you have these insights into things that you're hearing things that normally kids don't come out with. I think sometimes I was bringing things to light that maybe people didn't care to hear. So, it was like, stop talking so much about these things, or be quiet now. Like,
yeah. And a lot of intuitive kids go through those challenges of, oh, grandpa said to me the other day, well, grandpa died last year. What are you talking about?
Exactly.
All right. And lastly, what's the number one thing on your bucket list?
Oh, travel. Yeah, I definitely would love to travel all over Europe. I've only been to a couple parts of it. I'd really like to see more of how people live in different cultures. Like, one of the classes I really want to take in Theta is world relations. I'm really interested in that and just expanding what I know about how people live in other places.
Yeah, and really get immersed and be a local for a while.
Yeah, I would love to go somewhere for like 3 months, at some point, and really immerse myself in a different culture.
Yeah, well, that sounds amazing and wonderful. It'd be very eye-opening.
Mm-hmm.
I would love to have perspective as well on how, our country is a little bit chaotic right now with the elections coming up, and it'd be nice to just get different perspectives from other countries on how they do it. So,
yeah, I would really love to do that. I've been to Italy a number of times. That's where a lot of my family is originally from. And they do have such a different perspective on life. And I'm glad that I've been exposed to that. Just having that contrast has been really great for me. There's such a zest for life. And I find there, and being really present in what's happening in the moment, not so much fear. I would say, and that was really eye-opening for me, because I did a lot of my travel there before I had children. And I really did draw on that, and as I went through my experiences with them. So I would like to see what else is out there.
Yeah, definitely. Well, I wish you the best in your travels. That sounds great. So,
thank you.
All right. So if listeners want to contact you to schedule a session, and we already established that being remote is not an issue at all, what's the best way to find you? My website is probably the best way to find me, and it's my name. So it's Michelle Giliberto, MichelleGiliberto.com. The different options that I have are listed on there, and I can schedule via my website for sessions. And I do sessions via Skype, FaceTime, or phone, whatever someone is comfortable doing. Okay, perfect. This week, instead of the WooWoo News Corner, I asked a friend to relay her personal experience of receiving an energy healing session. Here is Karen Lindenberg's narrative of her foray into the woo.
I've listened to every episode of Kim's podcast so far, and I've learned about several different modalities that I wasn't previously familiar with. I've also been wanting to contribute in some way, so when Kim asked me if I would come on the show, was funny because the first story that came to mind was what I would probably call my gateway into the woo story, and it happens to involve a medical intuitive. What is a medical intuitive anyway? Well, according to Wikipedia, a medical intuitive is an alternative medicine practitioner who claims to use their self-described intuitive abilities to find the cause of a physical or emotional condition. I'd say that's a pretty apt description. And to the skeptics out there who would call that a bunch of hoo-ha, I would say, I hope that my story opens something in you. About 16 years ago, I was living in Seattle, having moved there as a result of my tech startup being acquired by a large Seattle-based software company. This meant that I, along with around 60 other individuals, many of whom had families, picked up our lives and moved them from the Bay Area to Seattle. I was in my mid-20s and in a relationship, my first significant one wherein I lived with my partner. We had a pretty volatile go of it towards the end. A couple of years after the move, we split up. At around the same time, the large software company that had acquired our company had decided to lay off about half the team, which included me. At the time, I was quite overweight for my frame. I weighed close to 150 pounds. That's a lot for a gal that stands at 5'1" on a good day. Although, side note, my driver's license officially, one might say defiantly, says 5'2". I was what I would call lightly active, meaning I, quote, went to the gym and, quote, went to yoga. But I had just come off of 2 years of a pretty stressful and sedentary IT job, and I had been raised on the strict Filipino diet of eating lots of meat, precious few vegetables, and lots of extremely processed, sugar-heavy foods. Just to give you an idea, did you know that typical Filipino party spaghetti is sweetened with sugar and is served with sliced hot dogs in it? Yeah, I had a lot of that growing up. With the stress of the job loss, as well as the stress of the relationship ending in a very emotionally traumatic way, as many lesbian relationships do, I found myself at a huge crossroads, and my body was feeling it. I felt heavy, emotionally, physically, and energetically. I'd also developed severe eczema in several places on my body, but the main spots were my chest, my neck, my eye, and right beside my mouth. Later, I would learn that these places corresponded with some key energetic centers that had been impeded, if not shut down, for a long time. My heart, my throat, my voice, and my intuition. My body was in crisis. My being was in crisis. I needed to do something about it, but I wasn't quite sure what. I'd been to Western doctors who prescribed me steroid creams to address the eczema that only kind of worked. I went to naturopaths who sent me home with lots of supplements that didn't seem to do anything for my mood, my stress level, or my skin. I'd been to lots of traditional therapists over the years and experienced mixed results, even with the ones I actually went to consistently. Somehow, I felt that the sum total of what I was experiencing was beyond the reach of what we'll call traditional treatment could do. I don't think I was even consciously searching for it at the time, but something in me knew that it was time for something different. Then, one day at a party, a friend of mine who had gone through an intense healing period in her life recommended that I see her energy gal. Something about the way she described it, even in the vaguest of terms, felt extremely compelling to me. It felt like something deep within me was shouting, yes, you need to go see this woman. So, of course, I went. I showed up at Marie's door at our appointed time. Later, when I would recount the story to many, many people over the years, I would say that one of the things that makes this whole experience more believable for me was that Marie wasn't some 20-something gal in a muumuu burning incense in a hippie house and looking into her crystal ball telling me stuff. No, here I was at the lovely home that a very normal-looking professional woman in her 40s shared with her daughters on a quiet suburban street in Washington state. She greeted me warmly and invited me to sit in the living room, where on the coffee table lay a book of basic information about the chakras. I remember her asking, "How much do you know about chakras?" And me saying something about being embroiled in yoga teacher training at the time, so yeah, a lot. Great, she said. She told me a little bit about how she came into this work. Her gift for perceiving and later manipulating energy began to reveal itself during her previous career as a nurse working in an oncology ward. Seeing patients grapple with their physical symptoms and being able to sense the energetic backstory behind them gave her a profound understanding about how energy and disease worked in the physical body. She eventually decided to take her energy show on the road, as it were. While I met her in what I think were the early years of her practice, today she has thousands of clients all over the world. We talked a little more about her process and what to expect, and then we went into the treatment room. It was a pretty small room, but big enough to comfortably hold a massage table, some bookshelves, and a stereo. I lay down on the table and looked up at some Mediterranean-reminiscent hand-painted vines and grapes on the ceiling. It was pleasant. The house, the room, all of it felt light and bright. As I closed my eyes and got comfortable at Marie's instruction, she then told me about a presence she felt in the room. As it turned out, Marie is also a medium, which means she can sense and communicate with people on the other side. She described a young man who could only have been my late stepbrother, who had been murdered when I was in the 8th grade. I hadn't thought about him in a long time. Pretty soon, I became extremely emotional and started sobbing on the table as she told me that he was sending her a message to tell me that he loved me and that he was so proud of me for all I had accomplished. I felt so grateful for that message. Marie continued to work with my energy. Her primary modality at the time was Reiki. In fact, I later got my master's attunement from her. And so it was a lot of her gently placing her hands on my body in the different areas that corresponded to the 7 major energy centers, which we in the WooWoo world refer to by their Sanskrit name, chakras. As I was drifting in and out of opening my eyes and closing them in relaxation, I would see Marie drawing what I now know are Reiki symbols in the air, all the while keeping at least one hand on my body. Her hands grew extremely warm, and I grew increasingly cooler, and my stomach gurgled quite a bit. She said all of this was typical, and a good sign that I was taking in what I needed to take in, and what needed to move through was moving through. She dialogued with me as she worked on me, and one of the things she told me was that I had an intense overgrowth of candida, and that I should really cool it on the sugar. I told her I didn't know what that was, and she told me that it's a yeast that lives in our gut that most people have, but that it could overrun our gut and impact our ability to absorb nutrients. She told me that she saw the yeast in my gut and that it had spread throughout my body. I don't know why, but somehow that message hit a very deep place in me, and intuitively I knew she was right. She told me I should begin to take some probiotics, also something I had not known about before, and a couple of other supplements. The rest of the session went as I now know most energy healing sessions go. I felt relaxed, inexplicably lighter, calm, and perhaps most importantly, clear and hopeful, like there was a light at the end of this extremely stressful tunnel I'd been going through. To give you an idea of how long ago this was, Marie recorded my session and gave me a cassette tape to keep. For all the millennials out there listening, file this under #oldschool. Little did I know then that I would accumulate a shoebox full of these tapes over the years as I kept coming back to Marie regularly. I'm pretty sure I still have that shoebox somewhere. After that session, I became pretty obsessed with learning more about Candida and, more importantly, getting it out of me. I read extensively about it and learned everything that I could. I won't go into the nitty-gritty of it here, but suffice it to say that I was experiencing many of the textbook symptoms, including the eczema that plagued my skin in a very visible way that made me very self-conscious. I felt that Marie had given me key information that no one had ever given me, simply because she had a level of esoteric access to my being that no one else in my life had. Today, there are a lot of Western doctors out there that are observant of how Candida overgrowth can manifest in the body other than your typical yeast infections. Whereas over a decade and a half ago, it was still something that many doctors scoffed at and wouldn't bother diagnosing. Even the naturopaths I saw didn't think to test me for it. And since I didn't know about it, I didn't have the language to have that conversation with the medical professionals that I saw. Over the next 6 months after that first session with Marie, I worked really, really hard at reversing the awful way of eating I had grown up with. I eliminated all fruit, wheat, and yeast from my diet. Yes, even fruit. This elimination diet was and still is one of the hardest things I've ever done in my life. It was almost like I could feel the candida fighting me as I tried my best to eradicate it from my body. To top it off, I was a strict vegetarian at the time, so basically I ate a lot of tofu, quinoa, and spinach. I even gave up coffee for something called twig tea, which I sweetened with stevia. Let's just say I'm super glad that I can eat normally for the most part now, with the exception of still watching my sugar. I lost about 30 pounds. The eczema eventually subsided and hasn't returned since. In conjunction with the elimination diet, the intense amount of yoga that I was doing as part of my teacher training had transformed my body. For the first time in my life, I felt light and toned, like I was finally in the body that I'd always wanted to be in. I'd literally transformed myself. I found myself. And I think this is pretty common with people's first WooWoo experience. And so, to the skeptics out there, I would say, things like this are best believed firsthand. The woo has a profound potential to transform your life. Once you open your mind and heart to that potential, it's just a matter of when and how. When I tell people the story of this time in my life, I say that Marie, who I now refer to as my energy gal, saved my life. And I firmly believe she did.
Thank you for listening to WooWoo for the Skeptic. Join me on my Facebook page, as I would love to hear from you if you have ideas for a show or want to give feedback on an episode. If you found this topic of medical intuitives intriguing, please share it with another friend who might find the topic compelling as well. And now for your moment of woo. This quote comes from Henry David Thoreau. "It's not what you look at that matters. It's what you see." Have a great week, everyone.